Hi, this is Dr. Paul. Coughing is quite common at this time of the year, and there are many reasons why it will cause a cough. And last week, we introduced to you the first section called Cough, Cough, Cough. And if you have not listened to it or watched it, please click this link that I gave you and watch it first before you come back to this video, where it's a continuation of the coughing saga that you may have. Now, if you still don't get better from staying out of all the dust and the mold and the irritants that I talked about last week, then you may need to try an over-the-counter nasal spray and antihistamine. You got to flush your nose with salt water every day and see if that would help. If it still does not work, then I think that it is time to look for possible reflux, hiatal hernia, and the reflux is where the acid in your stomach goes all the way up to your throat, irritates your throat, and cause the cough. And what can you do? Well, you can try over-the-counter famotidine, 20 milligrams a day first. Eat a smaller dinner every night. No more snacks afterwards. Raise the head of the bed up before you go to sleep. And if you still don't get better within a week or two, then I think that you need to have your esophagus looked at and make sure everything is good down there. And if those are all normal, your doctor would do a sleep apnea screening test because it is quite common in our age to have this issue. Now, the next slide is extremely important because if you have cough daytime, nighttime, all the time, and you even have some chest tightness and shortness of breath every time you do anything, then I think that you may have asthma or COPD. If you were smoking, vaping, marijuana, you should stop. Your doctor will order a pulmonary function test to diagnose the asthma or COPD, a chest x-ray to make sure the rest of your lungs are A-OK, and then he or she will try you on some inhalers to see if it will help you with your breathing. Now, I will not wait for that because this is quite serious. And if you wait long enough, your lungs can be permanently damaged, and eventually you might end up with oxygen for the rest of your life. So take heed, take my warning, and now you understand what to do if you have a nagging cough. If you like what you hear, please give me a thumbs up. Recommend that to your family, and friends so they too know what to do with the rather common symptoms. Now, I will see you again and talk to you about another medical minute in about 7 days. Thank you very much for your attention.